Okay, guys, so we're going to focus on the concept of infection for this lecture. Uh, so infection is based on the invasion of body tissue by microorganisms with the potential to cause illness or disease. The human body is continually threatened by foreign substances, infectious agents, and abnormal cells. In response to widespread antibiotic use, resistant microorganisms have emerged, such as methicillin-resistant Staphylococcus aureus and multi-drug resistant tuberculosis. New diseases have also emerged based on this rate of infection. So here are your learning objectives based on the syllabus. I'm not going to read them, but there they are. All right, so some common labs that we will see when you are testing patients for specific infections. We have the white blood cells, which is a breakdown of the number of types of white blood cells. Normal white blood cell count is between 5 to 10,000. Blood cultures are also performed. A sample of blood is placed on a culture media and evaluated for growth of pathogens. Normally should show no growth of infectious microorganisms. Blood cultures typically take about 72 hours for results to show. And remember, as I discussed earlier today in class, blood cultures are taken from two different peripheral sites to determine what type of microorganism may be in the blood. Urine cultures also take about 48 to 72 hours, typically 72 hours. Urine typically is normally sterile with no microorganisms, but based on certain specific disease processes, they may come up positive. Throat cultures and wound cultures, the presence of microorganisms typically is normal. There should be no growth of infectious microorganisms. However, there may be a throat culture could be done for like streptococcus. Wound cultures can be done for MRSA as well as strep as well. Disease titers, they're blood tests that are specific for disease, like for immunity. An example of that is rubella. There's also panels to evaluate specific disease exposure, like blood tests to see if people are HIV positive or have hepatitis as well. Immunoglobulin, IgG and IgM levels, those are to evaluate humoral immunity status. Sometimes they can be done for allergy testing. C-reactive protein, it measures inflammatory change or bacterial infection within the body. Agglutinin is used to diagnose atypical infections by detecting antigens in the blood. Erythrocyte red blood cells, called erythrocyte sedimentation rate, also known as ESR or SED rate. It measures inflammatory changes within the body. It will increase if there's any inflammation anywhere within the body. Normal is at 15 millimeters an hour for men and less than 20 an hour for women. All right, so the first disease process, we're going to talk about skin and soft tissue infections. They're abbreviated as SSTIs. And the first one we're going to talk about is cellulitis. So cellulitis is a acute deep bacterial infection of the skin. It typically affects the arms and legs, more so seen on the lower extremities, but it can also develop around the eyes, the mouth, the anus, or on the abdomen. It typically occurs after there's been some type of injury, which causes a break in the skin to occur. And with that, the area can happen from like trauma or surgery or a bug bite or any injury like that. If it's left untreated, the infection can spread to the lymph nodes and the bloodstream. Patient becomes septic. It's usually spread person to person. Its most commonly infected bacterial mechanism is Streptococci or Staphylococcus aureus, are the most common microorganisms that affect cellulitis. And you can see here some of the symptoms, or the way it looks. It's very red, it's swollen, it's irritated. Some of them you can even see like the dimpling here in the skin. You can see this one, the whole leg is swollen. Same with this one. This one almost has like a bruising type of area. You can see here. All right, so some signs and symptoms of cellulitis are a diffuse spreading of the dermis and subcutaneous tissues. So make sure you note of the dermis and subcu areas. It can be red, lilac, tender, warm, edematous skin that tends to expand rapidly. Again, there's a skin dimpling, so it looks like maybe like cellulitis almost, cellulite like in your skin. Inflammation is the chief symptom. It can be localized or it can affect the entire limb. They will have an increase in white blood cells. They can have a fever, chills, lymphadenopathy can occur, blisters. There's going to be lots of swelling, and sometimes the skin can't handle the amount of fluid because of the cellulitis, and blisters can occur. They can also have localized pain to the area. So some other symptoms that they can have are like specific, like I said, like the purplish spots on their legs as well. So causes, it's when bacteria, most likely, like I said, Streptococcus and Staphylococcus, enter through a break in the skin. It's a more serious staph infection is the methicillin-resistant Staphylococcus aureus or MRSA. It can also cause infection to occur. This is more difficult to treat as the range of antibiotics to treat are limited. So some risk factors. Patients with any open area of skin that gives bacteria an entry point are at the highest risk because the bacteria do multiply very easily, causing inflammation to occur. Patients with a weakened immune system are at risk. Skin conditions, including dermatitis, eczema, shingles. Patients with long-term swelling of the arms and legs with like lymphedema are more susceptible to cellulitis. Any patient who has a history of cellulitis, being obese is a risk factor. Cellulitis can also occur like from if somebody has like a sinus infection, they can get orbital or periorbital cellulitis, which can cause vision loss. With the lymphedema, the buildup of the fluids in your tissues and the swelling because of the lymph fluid in your body can cause you to be more vulnerable to infection as your lymphatic system is damaged or overloaded, and it can't function adequately to fight off the infection. And then patients with history of diabetes, and that is because of the delayed healing process with the diabetic patients. So some complications that can occur, bacteremia, which is bacteria in the bloodstream, endocarditis, which is inflammation of the endocardium of the heart, osteomyelitis, which we're going to talk about in a couple slides, toxic shock syndrome or sepsis. A rare complication that can occur is necrotizing fasciitis, which again, we will talk about that in just a few slides. Recurrent episodes of cellulitis may damage the lymphatic system and cause chronic swelling of the infected limb, discoloration. A lot of times you'll see these patients who have had cellulitis, their leg will be swollen, very swollen, even months after. They can have like dry skin where just skin flakes off. So those are some things that you can see for long-term issues with these patients. So prevention, the best prevention that you have for cellulitis is washing the wound daily with soap and water, making sure that no bacteria gets in it. So covering it with the bandage. Watch for signs and symptoms of infection, irritation, pus. If a patient does notice a little redness to the skin, the best thing is to take a black permanent marker and outline the border to make sure that the redness isn't spreading out. All right, so some diagnostics, treat with systemic antibiotics. We need to be verified with wound culture. Treating infections without guidance from cultures puts patients at risk for side effects, but it can also exacerbate the patient's resistance to antibiotics. If a patient is symptomatic of a systemic infection, blood cultures do need to be obtained. So if they're having any other symptoms that you think may solicit that they have like bacteremia, so the infection has gone to their blood, so they're more systemic, like they're hypotensive, they're tachycardic, they have a fever, then we probably need to get a blood culture. Oral antibiotics usually are effective against the streptococcal and staphylococcal infections. So like for strep, penicillin, oral erythromycin, if the patient is allergic to penicillin, or a cephalosporin type of antibiotic. And if it's a staph infection, cephalosporins, sulfadrugs, or vancomycin. Also, Keflex is a really popular one to treat skin conditions of cellulitis. Systemic antibiotics, analgesics for severe cases or large affected areas. Recovery usually begins within 48 hours after the initiation of antibiotics. Therapy should continue for at least 10 days. Elevation of the affected area above the heart to reduce swelling will help to prevent swelling and encourage the area to heal. We want to also make sure that we initiate infection control measures for these patients. So the first, like I said, penicillin is a very common one to treat this type of disorder. Some examples are penicillin G, amoxicillin, ampicillin, and piperacillin. The reason is an anti-infective for skin, can also be used for the GI tract infections, urinary tract infections, and some pulmonary infections. Expected outcome, infection improves, white blood cells decrease, fever resolves, symptoms resolve. Some complications or unexpected outcomes include fatigue, rash, GI symptoms like nausea, vomiting, diarrhea, abdominal pain. Some contraindications are if they've ever had a hypersensitivity to any of these medications, if they have severe renal or hepatic impairment. Cautions, mild to moderate hepatic or renal impairment, and those that are HIV positive. We also want to educate the patients to assess baseline and evaluate infection, obtain specimens for culture and sensitivity before we initiate the antibiotic therapy. We want to monitor their eyes and nose, tell them to take with a full glass of water, monitors for side effects like GI symptoms, rash. We want to monitor their CBC, their liver function tests, and renal function. And we want to monitor for interactions with NSAIDs, oral contraceptives, and warfarin. And the other type of medication are cephalosporins, and some examples of those are ceftriaxone, cephalexin, Ancef, Keflex, Rocephin, and Maxipine. Again, anti-infective for urinary and gynecological disorders, skin, intra-abdominal bacterial infections, and sepsis. Expected outcomes are infection improves, white blood cells decrease, the fever resolves, symptoms resolve. Some complications and unexpected outcomes are seizures, if it's a really high dose, headache, rash. They can get Clostridium difficile, which is a GI disorder that happens when all of the good bacteria that's in your gut is removed from the antibiotics, so you get this disorder. You will learn more about it next semester. GI symptoms, kidney damage, yeast infections, bone marrow suppression. Contraindications, again, is any hypersensitivity in the previous past to cephalosporin, or if you have a serious sensitivity to penicillin. Cautions, renal impairment, GI disease, and elderly. We need to monitor their infection, obtain specimens again before we administer, monitor for same thing, GI, looking at their CBC, their renal function, bone marrow suppression, make sure that we give with food to prevent GI upset. All right, so this next portion, we are going to talk about our necrotizing soft tissues infections. So this is what a necrotizing soft tissue infection looks like. I mean, the dark area is pretty much dead tissue, so it's necrotizing. It's dead. There's no perfusion to that area. It's not oxygenating. It's not really good. It's also referred to as the flesh-eating bacteria, is what necrotizing fasciitis is referred to as. So they are life-threatening bacterial infections that cause necrosis of tissue. It can spread through the dermis, subcutaneous tissues, fascia, and muscle. Group A strep is considered the most common cause. It spreads very rapidly and destroys tissue. Necrotizing fasciitis is the most common because the fascia's poor blood supply and limited immune function. So that's the part of the skin that is typically most at risk. Necrotizing infections lead to edema and vascular occlusion, causes ischemia, which is, that area is not getting oxygenation. So it starts to die off, and then tissue necrosis. Most common areas are the abdomen, lower extremities, and the perineum. So some signs and symptoms. So early, again, it usually starts with cellulitis. So it starts with the localized abscess or cellulitis, and it like rapidly progresses really quickly. They'll have swelling, edema, skin discoloration, like I showed you, those ischemic patches, and then cutaneous gangrene. So that necrotizing, that dark tissue looking thing. They can have subcutaneous emphysema or crepitus wherever the area is. Later